September is Sickle Cell Awareness Month. Nearly 100,000 Americans are living with sickle cell disease, and that includes Rae Blaylark's son, Trey. Rae founded the Sickle Cell Foundation of Minnesota to help bridge the gaps between those living with the disease, their caregivers, and healthcare providers. I talked with Rae tonight to learn more about the disease. We'll start with the first question for some who maybe just don't know, what is sickle cell disease?
Well, sickle cell disease is a genetic blood disorder that causes the red blood cells to be shaped like a sickle instead of a donut like most of our red blood cells. It causes a lack of oxygen in the red blood cells and creates something like a red blood cell traffic jam that causes tremendous intractable pain and other very serious life-threatening complications. And it's the most common genetic blood disease in the world, with a global impact on almost all ethnicities. And in the U.S., more than 2,000 babies are born with the disease every year.
From what we understand, even though it's passed down through genetics, maybe parents don't always know that they're actually passing it down?
That's true. If you're a carrier or if you have sickle cell trait, there's not typically any sort of outward symptoms. So you can go your entire life without knowing that you have it unless you were expressly told that you're a carrier.
So this has been around for a while, but now we're in the midst of a pandemic. How has the COVID-19 pandemic been affecting families or for people that have this disease?
Well, that's a really good question, because some of the most dangerous complications associated with sickle cell disease closely mirror the respiratory distress of COVID-19. So my son, who has sickle cell, was hospitalized in July, and as his mother and advocate, I sat in the waiting room for 6 hours waiting for his COVID test results to return negative before I could join him in his room. And a wave of fear came over me, because I know that there's a lack of understanding at times around sickle cell. I know he didn't have an advocate by his side, and I know how a misdiagnosis could have deadly consequences. So there's great concern that those with sickle cell disease may be dismissed, misdiagnosed, or undertreated as a result of these similarities and the miseducation.
And if someone is undertreated, what could be some of the fatal ramifications that lead to that from sickle cell?
Yeah, we talked about the similarities in the respiratory distress. There's something called acute chest syndrome. It is one of the leading causes of death. And if you put those x-rays side by side to someone with COVID, they look so similar that someone without any previous knowledge of sickle cell disease may misunderstand it and may call it something else. And that person can go into tremendous respiratory distress. There's a number of infections that they are susceptible to as someone living with sickle cell disease. So it's really a lot of the underlying conditions that are caused by the sickle cell disease that we really have to be concerned about, and the organ failure that results from it.
Well, this interview alone, I think, is increasing awareness about the disease, but how is the Sickle Cell Foundation trying to make sure people are aware of what's going on?
Sure. As a patient advocate, I realize that there's a long history of healthcare inequities and injustices that were standing in the way of quality of care and improved outcomes. So in 2015, I founded the Sickle Cell Foundation of Minnesota. It's a patient and community advocacy organization that really brings a voice to this disease and aims to bridge the widening gaps between patients, caregivers, and healthcare providers in order to improve the outcomes for this community.
And when you say improving outcomes, how are you guys trying to carry that out?
Well, ultimately, we want to improve the quality of life for those living with the disease. And because sickle cell disproportionately affects Black and brown people, we want there to be better understanding, better compassion for those who are living with the disease, and we want to make significant movement towards a cure. So we're actually really excited because the CDC recently announced a 3-year funding grant to implement sickle cell data collection program in our state. And our foundation will continue to work with the Minnesota Department of Health and other partners to better capture the number of sickle cell disease patients in our state and how healthcare is being utilized in this population, and most importantly, to help inform strategies to improve those outcomes.
Well, Rae, you've shared a wealth of knowledge, but if people still wanted to learn more about this disease, how could they do so?
I encourage people to go visit our website, SickleCellMN.org. Again, SickleCellMN.org. They can learn more about the disease, the foundation, and how they can help.
Well, Rae, thank you for talking with us, and if there was ever to be an advocate for bringing up awareness about sickle cell, I think you're the person. Thank you again.
Thank you so much.
You'll find a link to the Sickle Cell Foundation of Minnesota at WCCO.com.